There is nothing more critical to life than blood, and for the NHS, one of the largest healthcare providers in the world, there's a complex and demanding supply chain for blood components of all kinds. This centre in Bristol is responsible for testing and processing donations, as well as managing and replenishing stocks at hundreds of hospitals across England. It's a round-the-clock operation that requires responsive, demand-driven planning. And by working with ToolsGroup, the NHS Blood and Transplant Service has been able to develop its vendor-managed inventory, or VMI service offering, to bring a new level of automation and intelligence to this unique supply chain.
In the past, we have operated through a sort of push approach. We've collected blood from donors, whatever's come through the door, and we've pushed that through to hospitals. The partnership with ToolsGroup enables us to adopt a pull approach. So using VMI, we can understand real-time demand from hospitals. And understanding that demand enabled us to plan all the way back through the supply chain, through what stock we need to hold in hospital services, what the delivery profiles need to look like, what we need to manufacture, what we need to collect, and also what the mix of our donor base needs to look like.
We needed a platform that was scalable so that we could actually roll it out to all of the hospitals, so that for the first time we could get demand data from all of our hospitals right through from the donor to the patient, so a vein-to-vein model, which is pretty unique in terms of blood supply. So ToolsGroup came on board to help us with the transition from our home-built, quite basic model to a much more comprehensive tool that we're now using with hospitals today.
And this tool, known as SO99, not only allows for intelligent prediction, supply and delivery without hospitals needing to order, but a greater understanding of the different blood components and types required at any given time.
In the case of NHS blood and transplant, we've got visibility of what is happening at the hospitals almost every 10-15 minutes. So we can see what's actually in the blood fridges. That information gets sent back via an electronic signal, and then we're able to respond to that either by delivering an emergency order or just topping up to their required levels.
We can take responsibility for their stock, for replenishing it, and making sure they've got the right blood at the right time in the right place. And the feedback we've had from our hospitals has been very positive. The ones where we've now rolled out VMI are telling us that it delivers them a more patient-focused service. It frees up their time to do their core activities and their core role. It reduces costs as well. So it really is a win-win.
Hospitals have been able to save something like 20% of their delivery costs and at least 30% of component wastage, because we've been able to optimise the stock levels at the hospitals, and that ultimately results in savings for the NHS as a whole, and that money then can be ploughed back into patient care.
And by working together to create greater end-to-end optimization in this supply chain, there's potential for further streamlining of production, testing and collections.
We can now take the pool signal from a patient needing blood in hospital all the way back through distribution, manufacturing, right the way back to planning donor sessions and the collection of blood.
ToolsGroup is a proven innovation partner that works successfully with businesses of all kinds to deliver exceptional customer service and the availability of critical products where and when they are needed.
ToolsGroup have been crucial to delivering our success. They have brought their experience, they brought their skills, but I think most importantly they've been flexible in ensuring that they're able to work around our unique requirements of ensuring we've got a safe and sustainable blood supply.